Hi, I'm Lindsey, and I'm talking with Medtech industry leaders on how they change lives for a better world.
The inventions and technologies are fascinating, and so are the people who work with them.
There was a period of time where I realized fundamentally my job was to go hang out with really smart people that are saving lives and then do work that would help them save more lives.
I got into the business to save lives, and it is incredibly motivating to work with people who are in that same business, saving or improving lives.
What better industry than where I get to wake up every day and just save people's lives?
These are extraordinary people doing extraordinary work, and this is The Leading Difference.
Hello, and welcome back to another episode of the Leading Difference podcast. I'm your host, Lindsey, and I am so excited to introduce you to my guest today, Annmarie Ison. Annmarie serves as the Vice President and Head of Service at Elekta. With over 25 years of experience as a software development professional, Annmarie specializes in product development and software architecture for information management systems and radiation therapy delivery devices, specializing in software interconnectivity, machine functionality, and clinical workflow. She is highly effective in directing all aspects of the software development lifecycle and is passionate about new technology, customer relations, and products that have the potential to enhance the standard of care in oncology. Welcome to the show, and thank you so much for being here.
Oh, thanks for having me, Lindsey. I'm really excited to be here and chat with you and see where this goes.
Absolutely. Well, I would love if you wouldn't mind starting by telling us just a little bit about yourself and maybe your current role.
So, my current role is I'm head of service for the software products at Elekta, and these products support radiation therapy and medical oncology in for clinics to deliver therapy, both chemo and radiation therapy, in a more efficient, safe, and effective manner. I actually, for many, many years, was in engineering, and this role in service is fairly new to me. It's only been about a year that I've been in this role. I sometimes wonder how I got here, but I think it really comes from the fact that I love interacting with customers. I started with the company as a startup, and there were only about 20, 25 people when I joined. And so you did a little bit of everything. And one of the things that got me really excited was working with our customers, talking to them, finding out what they need, why they need it, what they're doing, and also occasionally having those uncomfortable conversations on why things aren't working and how we can make them better and how we can fix stuff. And so I think over the years, I've done different, as I said, different roles. I did some product management and went back to engineering again, and then recently took on this challenge of service because, yeah, I just love interacting with the customer for good and for bad. And I really want to help them be better, help us be better by helping them be better and do their jobs in a easier way so that they can focus more time on the patients and less time on the stuff that they have to do. Computer systems are everywhere. We all have to use them, right? We have email and we have everything. And I don't want our software products to be burdensome to them. I want them to be easy and streamlined and make their life easier. And again, so that they can make the patients' lives easier.
I love that. Oh, thank you so much for sharing a little bit about, your story and how you ended up in this new role. This sounds like a wonderful blend because you have this, I can already tell, this heart for other people and making a difference. And then you have that combined with your love of people and your enjoyment with working with them. And that's not always easy. So I love the fact that you're able to combine some of those passions. And I'm curious, how did you start getting involved with the company at the beginning when it was first a startup? How did that all come out?
That was really just by happenstance. I'm going to go back even further and say, as a child, as a kid, 9, 10 years old, I loved science. I was always into science. I had experiments. I had a chemistry set in my bedroom. But I always just assumed that I would be a doctor. And it wasn't, it's going to sound really weird. It wasn't that I wanted to be a doctor. I just assumed that's what one did. If you were good in science, you became a doctor. That was the only path. And I really never gave my career choice. It wasn't a choice, actually. It was the only path. I never really gave it much thought until I got to college. And of course, I was pre-med. And I started meeting my new classmates and talking with them about why they wanted to be a doctor, why they were drawn to the practice of medicine. And I realized really quickly that I wasn't. That wasn't me. That isn't what I wanted to do. I didn't have that. I didn't aspire to practice medicine. And so I kind of pivoted and I went away from that completely and I studied physics. And I focused on physics. And to me, I picked physics because to me it's foundational. And plus, physicists have the best toys. We get to play with all sorts of cool things. But to me, it was foundational and it really helps you understand a lot of other disciplines. And at the same time, I was into mathematics and other stuff. And this was many years ago for those younger folks listening. Computer science as a degree as we know it today didn't actually exist back then, or at least not at a lot of universities, and certainly not the small liberal arts college that I went to. But the courses around computer science were taught out of both the physics and mathematics departments. And so I was really fortunate to have these great professors who were, I consider, on the forefront, at least to me, they were on the forefront of figuring out how to use computers, and I'll really say PCs, as a tool to connect the physical world and the digital world and use it to do the things that computers are really good at and let humans do what humans are good at. And you could focus on this physical situation, and the data collection and data analysis was all done by the tools that we take advantage of or take for granted today. Excel and things like that didn't exist back then. It's a long time ago. So anyway, it kind of pivoted away from that, from healthcare and being a doctor altogether, and focused on physics, went to graduate school. And when I left graduate school, I really wanted to do exciting things like pay rent and eat. So I found myself in aerospace. And it was really interesting. I also found myself in Silicon Valley. I met my husband who grew up there, so that's where we wound up. And in aerospace, I had, like I said, it was a cool job. I liked it. I was working on satellites. GPS was kind of a new thing then. It was really just coming into its own. And I even got to work a bit on the space shuttle. So I was very excited. I was happy to stay in that role. But unfortunately, the job moved out of the Bay Area. And I found myself going, what do I want to do with my life now? But there were so many exciting things happening in Silicon Valley at the time that it felt like there was a startup on every corner, or really in every garage, right? And I just really by happenstance found this startup. And during my discussions with them, I met the principals and they shared their vision with me, and it just resonated. They were working to change the face and the trajectory of radiation oncology. And when they explained their vision, I saw it. And I also saw a path to get to that vision. And even more so, I felt like I saw how I could bring everything that I had done up to this point. My physics background, because there's a lot of physics in radiation oncology, my safety background from manned spaceflight, and my desire to do good and help people from when I was a little girl thinking about being a doctor. I was able to bring all of that together into this one job, and I'm going to say I was hooked. And I haven't looked back. I've been with the company aiming for that vision really for the last 29 years. And I'm still striving for that vision because it really was so visionary that we're not quite there yet. There were paradigm shifts along the way, and we hit those and helped change how things are done and really form a market. But we're still striving. We're still striving to do better.
Yeah. Yeah. Thank you. Thank you for sharing about that background. I love how just love when a pathway isn't isn't as straight as we necessarily think it's going to be. It's kind of funny how you said looking back it was almost like this expectation I'll be a doctor. And then you were able to take your interest in science but your interest in lots of other things as well and then form this career path that's probably looked unexpected but seems to have wound you up in a place that you feel at home.
Yeah, totally. I do feel at home. And sometimes I want to go back to that 9, 10-year-old self and go, see, there isn't one path. There are options. There are so many different people and disciplines and viewpoints and technologies that are all needed to change healthcare, to advance the standard of care and the standard of practice. And you can make that difference by bringing your own set of skills, your own viewpoints, your own passion, and by just being you. And I hope that people hear that and realize that there isn't one path.
Yes, thank you. I am completely in agreement with you, but I also just appreciate that you shared that particular advice because I think you're absolutely right. There are always multiple avenues to a dream, and what might work for one person might be a different path for someone else. Well, so are there any moments that stand out in particular as just having this moment of realization that you are where you're supposed to be, like you're in this field, you're at this company, you're doing this particular work, just anything that stands out in particular as yes, I am in the right place at the right time.
Oh, goodness. I mean, it's been a long career, so there are so many things that I'm proud of, but there's a moment that sticks in my head from many years ago, maybe about 2 or 3 years after I joined the company. There was a new form, a new technique in radiation therapy that was trying to become, I'm going to call it mainstream or standard clinical practice. But there was a challenge there that the amount of data that was involved preparing the patients for the treatment was huge. Hundreds, thousands of pieces of data that the medical physics team had to check and recheck and do measurements on. And it took a lot of effort. And we were working with some of our customers to try to streamline that process and provide them the confidence. Some of these checks, again, people can do those checks, but computers can do those checks really fast. And so we were working with a number of customers. And there was one night, and like I said, it sticks in my head. Can I say I was in a bar in Saddlebrook, New Jersey, of all places?
Of course.
I grew up in New Jersey, so maybe that's why it sticks out. But where I was talking with a colleague, a customer, and we were going to give a seminar the next day, and he was putting his slides together and going over them with me, and he had told us that he was able to get this effort that took him like 30 or 40 hours down to about an hour. And we were like, wow, that's awesome. That's fantastic. And we were really excited about that. But it was the thing that he said next that really stuck with me. And there's 2 points on it. The first is he said, and now we don't have to choose. If the clinical indication requires this kind of treatment, we can offer it. And like that just hit me. And I was like, wow, we moved the needle, right? We really moved the needle. And I was really excited about that statement. But it also hit me in a slightly different way. It reminded me that in all the rush to and the day-to-day responsibilities of getting these features to the market and who has to sign what paper and what form has to be done and what project plan has to be completed and all those things, that I actually didn't think about the patient. I'd forgotten about the patient. And really, since that day, I actually felt bad about myself when he said it. I kind of was elated and angry at myself for not keeping that patient and that set of patients in mind. That really, since then, every day, I think about the millions of patients that are impacted by the products that we work on. And I also think about each individual patient when I'm never sure about, is this the right thing we should do? Are we working on the right thing? Is it good enough? I think about the patient, the individual, who could be anyone. It could be your brother, your sister, your spouse, your next door neighbor, your child, as well as I think about that vast set of patients that can be impacted. And it helps recenter me and refocus me to make sure that I know I'm doing the right thing. And it's just stuck with me all those years. I'm a little bit of a broken record at work when I say 2.5 million patients, 2.5 million patients. Or I say, what about the patient? What about the patient? But I think in the end, it serves us well to do that, to always keep that in mind.
Yes, absolutely. And thank you so much for sharing that story. That's powerful. And so I know that women's health and advocacy for femtech, whatnot, that's something that you are interested in and passionate about. And I was wondering if you could share just a little bit about maybe your experience.
Yeah, so I think that access to care is really the key thing. And whether it's women's health, which I think is a huge issue of getting access to care, but it can be anyone really. As I mentioned in the previous discussion about bringing these advanced techniques to the clinical setting, there are areas of the world that don't have the resources. And the resources could be basics like electricity and access to power and things like that, but also the resources, skills, right? As I mentioned, medical physics is a big part of radiation therapy. And if you don't have really skilled medical physicists around, it can be difficult to use these really advanced techniques that can provide better care, fewer side effects, shorter treatment times. Again, if you're looking at someone who has to travel a long way to get to care, you don't want them to have to come back every day for 25 or so days. If you can shorten that down into a week or so, which we can with some of these really advanced techniques. But again, you need those resources, you need those expertise. And I think that's where the digital world comes into play again. And if anything, the pandemic taught us that we can do so much remotely. I can be, and we have this already today, you can have medical physicists from some of the leading clinics in the world here in the United States as well as in Europe looking at and supporting countries that don't have that same baseline of resources and technical expertise. And I think women's health comes into play there a lot in that there are many indications that are managed by radiation therapy. So I think, again, being able to offer these advanced techniques, shorter timelines, hopefully higher cure rates or at least control rates to these emerging markets and expand access to care is really important to me. And that's the direction that we have to go with in healthcare in general. Access to care is the key.
Yeah, yeah. Thank you for speaking to that and elaborating a little bit on that. And I I appreciate the fact that you and your company in particular are aware of those issues and are thinking through them and talking about them, and that's how change is going to happen. So it's always exciting to see.
Yes.
Yeah, absolutely. So pivoting the conversation just for fun, imagine if someone were to offer you $1 million to teach a masterclass on anything you want. It could be within your industry, but it doesn't have to be. What would you choose to teach about and why?
Oh my goodness. I think fundamentally I have a hard time with this question because I don't consider myself a master of anything. I always consider myself an intermediate because as I learn, I realize how much more I don't understand about them. But for the $1 million, and I'll take it, I think it would have to be something around cooking. I love to cook, but I wouldn't want to talk about technique, mastering a specific chopping technique or sauteing technique or whatever, but I think I'd call it collaborative cooking. I have so many friends who are intimidated by cooking and, oh, I don't know how to cook, I don't have a recipe. But I just can't think of anything more fun than to work as a team, bring everyone's different perspectives and skill sets and passions, if you want to use that word, together to bring a nice meal on the table. And if things go wrong, well, that's part of the experience. I also think that if you don't cook and you can still be part of the team. My family does this, my family and friends, we do this all the time. Someone, we have 3 or 4 people in the kitchen, all cooking together. Someone made the menu, someone else has picked the wine, someone's setting the table. Hopefully someone's pouring the wine too, but we all come together and it makes everything less, like I said, intimidating. You shouldn't be intimidated by cooking. It's fun, and there's nothing better than enjoying a nice meal prepared by all of us together. And that's kind of my feeling about a team also, is when you have a team working with food, like I said, dinner, it's no one's thing. It's everybody's thing. We all came together to make it. So it's no longer I cooked this, it's we cooked this, we did this, and we made this wonderful evening or afternoon or whenever it is you're enjoying it. So that would be my theme of the masterclass if I could.
I love that. I love that.
Yeah, just cooking with my nieces and nephews is always fun, and everyone coming together to enjoy and celebrate.
Yes. Yes. That is very exciting. And hopefully, like you said, the teamwork component of it will be joyful as all the families get together.
It can also be, I call it passionate. It can also be passionate at times. Like someone very strongly about the temperature that cookie should be cooked at. I don't know.
Yeah, that's right. And we're all working together towards a common goal. So gotta figure it out. Amazing. Amazing. How do you wish to be remembered after you leave this world?
This question I'm going to have a hard time with answering without getting very emotional. My husband passed away a few years ago, and he was in medical devices as well. We actually had a very similar background. He was a physicist, went into medical devices, and we actually talked about this when we knew the end was nearing. And his answer was, I want to be remembered that I helped. And I can't think of a better answer. I would love to be remembered that way, that I helped in some way, in all sorts of ways. That I helped my family and friends in times when they needed help, whatever that was. Might be cooking something for them, but also that I helped forward this vision that the founders of the company had, that I helped clinicians help their patients, and that I had some small impact on the standard of care and the direction of oncology. Yeah, that's the way I would like to be remembered, that there was some help. I can't think of anything better than that.
Yeah. That's beautiful. It's a wonderful thing to aspire to. Thank you for sharing those stories. Really appreciate it. And last but not least, what is one thing that makes you smile every time you see or think about it?
Oh man, I feel like I should say something honorable like my family and friends and things like that, but they would all know that I was lying if I said that. And I know the answer. The answer is pandas.
Yes.
I love pandas. As a little girl, I had a stuffed panda instead of a teddy bear, and I became a bit obsessed. And I consider myself now a recovering pandaholic. I had a rough week when the pandas left the National Zoo. It was very emotional for me,
Yeah.
but I still lean towards pandas. I can't help but smile and laugh when I see them. And if you were to look under my desk on my early morning Teams calls, chances are that I'm wearing my big fuzzy panda slippers while I'm taking those morning meetings.
Oh,
You don't know that, but I've got my big fuzzy panda slippers on most days.
I love it. Thank you so much for sharing that. That just makes me smile. I love pandas. Oh my word. And I just, every time I see those videos of those caretakers trying to wrangle the babies, oh my goodness, I love it.
If I wasn't doing what I was doing and helping people this way, that's my dream job.
Yeah. I have often said my retirement gig is going to be animal caretaking in some way. Oh my word. Well, this has been such a pleasure to speak with you today, Annmarie. I really appreciate you sharing a little bit about yourself and your background and how you came into this industry and just your heart and passion for people and making a difference. I really commend you. And I thank you. Thank you for everything that you're doing to change lives for a better world.
Oh, thank you. Thank you for having me. And I've actually listened to a number of your podcasts, so I feel honored to be a part of the group that you've talked to. And thanks. Thanks for inviting me here. I really enjoyed it.
Thank you so much. And thank you so much also to all of our listeners. And if you're feeling as inspired as I am right now, I would love it if you would share this episode with a colleague or two. And we will catch you next time.
The Leading Difference is brought to you by Velentium. Velentium is a full-service CDMO with 100% in-house capability to design, develop, and manufacture medical devices from Class 2 wearables to Class 3 active implantable medical devices. Velentium specializes in active implantables, leads, programmers, and accessories across a wide range of indications, such as neuromodulation, deep brain stimulation, cardiac management, and diabetes management. Velentium's core competencies include electrical, firmware, and mechanical design, mobile apps, embedded cybersecurity, human factors and usability, automated test systems, systems engineering, and contract manufacturing. Velentium works with clients worldwide, from startups seeking funding to established Fortune 100 companies. Visit Velentium.com to explore your next step in medical device development.